People from the community have a voice in what happens here.
The people of this community know them now as, you know, the North End Community Garden kids, and I think the community is really proud of them.
Everything you need is at your fingertips. When you walk through the door, if there's anything you need, it's right there.
It's kind of like one-stop shopping, and people sometimes are almost overwhelmed that, you know, their situation is taken seriously, and there's people there who can help them.
The health center and the people working here have been very dedicated to individuals in our community who are really underserved, who live on the margins, people who are living in chaos or in poverty, or who are homeless or insecurely housed.
They often comment on that, you know, gee, this place is great. I come in here thinking I'm just going to get my, you know, my anxiety medication, or, you know, something to do with like a physical symptom addressed, and once they engage in the relationship building starts, we can offer other supports to whatever the situation is.
It's just a very good way to deal with the individual and to help them get their needs met. And because I believe, and we believe as a health team, that we are not an illness model, but a wellness model.
It is a primary health care center where clients receive their first level of medical contact. And that doesn't have to be with a physician. It could be with various practitioners, it could be with a nurse, it could be with a nurse practitioner, social worker. But it all happens within the walls of the community health center.
Of course, most regular doctor's office, in primary care anyway, for family physicians, it's a private entrepreneurial business. So you get medical services, and depending on whether or not, I mean, you may get just medical services. Here, it's not just medical services, and in fact, we actively work to provide a broad spectrum of services that are based on, again, social determinants of health. So what we understand is that people's health is not just depend on medical conditions or prevention of medical conditions, it's very much determined by the social circumstances in which you live. And in this community, we know that there are a lot of challenges. There are issues related to poverty, to lack of resources, low education levels, low literacy levels, lack of affordable housing, that all have a huge impact on the health of those individuals. And if we don't deal with them, you know, as a medical office, you can they talk about non-compliance. People are non-compliant with what we prescribe for them. Well, if you can't afford your medications, or you know, have no child care, so you can't come back for appointments, or you can't read the information that's been given to you, none of that's very useful to you.
In 1971, in response to some proactive work on the part of 2 or 3 women from the community, a storefront clinic was opened on Gottingen Street to provide medical care to the population in that area, which hitherto had been provided by the outpatient departments at the Victoria General Hospital. These women, who were really, for their day, activists, felt strongly that this arrangement was completely unacceptable, didn't provide the kind of care that the community needed. And so this was the beginning of the North End Community Health Center. There now are many programs which have arisen in response to the needs that have been expressed by the community. And many of these do address the social determinants of health. Nutrition, addiction, mental health issues are the ones that are probably the most prominent. And so it's been really a very exciting journey.
It's a very vibrant place. That's one of the reasons why it's very special, because in a lot of offices, doctors' offices, health care facilities, everything seems so quiet and sterile. But when you come here, you know, you'll hear babies crying, you'll hear people talking, and it's very, very alive in the waiting area.
Because we are interdisciplinary and do not work in isolation within our own profession, there is a natural collaboration and communication on behalf of each and every client.
One of the things that's unique about working here at the health center is the collaborative team approach. I love that I can walk down the hallway to see Paul, who's the social worker here, when I have some needs of the client I'm seeing that are of concern. And I love when we get together to have our rounds that we can discuss clients and as a team come up with a plan of how to best address the concerns that are put forward at the table.
Now, collaborative practice rounds is totally focused on the client. We discuss what are the needs of the client, what kinds of things have broken down in the in the health of that person. Is there somebody else on the team that is better suited to meet that person's need? You know, do we need to meet with the client as a team to figure out how to help that person best? So that's where we discuss individual cases and try to come up with solutions that hopefully will work for the client.
Again, if we look in a traditional medical model, you don't necessarily see a lot of health promotion because it's treating disease after the fact. So health promotion is intended to optimize people's health now, and it often goes hand in hand with disease prevention, which is trying to prevent disease down the road. So it's looking at things like nutrition, living situations, circumstances, education, all of the things that go towards people practicing a lifestyle that promotes good health down the road.